formally begins our next session. Thank you all for participating in our legislative forum this morning. I hope you all had an opportunity to interact with those who are running for office and those who currently hold office positions. Our idea is to be able to have a conversation here with candidates, and as most of you know, we've been having conversations with candidates all year long. I should formally introduce myself. My name is Catherine Crist, and I'm the chair of the Accessibility for All Action Fund. Thank you. Thank you. We have two interpreters here today who will be, one will be interpreting for me, and her name is Joan Locke. And we have Epiphany Davis, who will be interpreting for Senator Chris Dodd. Now, it gives me great pleasure to introduce Senator Chris Dodd. He was a senator from Connecticut and actually arrived in the Senate on the same day as our dear Senator Tom Harkin, who we'll be hearing from here shortly. He is here to represent Vice President Biden and his policies, and so he'll be speaking to us about that. You'll also have an opportunity, if you haven't already, to spend a little bit of time with him during the meet and mingle. Angie is our timer up here, so if you start seeing minutes fly here and there, then you know what that's all about. She's counting us down. So thank you, and I'd like to welcome you officially to the Accessibility, Inclusion, and Outreach Historic Democratic Presidential Candidate Forum. Please put your hands together and give him a warm welcome.
Well, it's nice to be back in Iowa. Let me start there. It's been 12 years since I was in the state. Some of you look old enough maybe to remember that I was involved as a candidate for the presidency in 2007. I love Iowa. I brought my children out here. They were 2 and 6. Now they're 14 and 18. And the 18-year-old is voting. Not in Iowa this year, but still a voting age. So it's nice to be back and see an awful lot of old friends as well. And I don't have to explain to an audience like this in Iowa, the presidential candidates are obviously running all over the state and trying to meet as many people as they can. And my good friend Joe Biden, the vice president, obviously would like to be here rather than having me here, but like everyone else is moving around the state. So I hope you'll excuse him and forgive me if I don't have every detail down, but I'm delighted to be here in support of him. I'm also going to tell you, as I'm sure Joe would if he were sitting here, we happen to be blessed as Democrats to have a wonderful field of candidates. I know very little. There's some differences, but unlike other races where we've seen in the past massive ideological differences, and particularly on this subject matter, I think you're going to find great unanimity of thought about this community, that 1 out of every 4 adults is living with a disability of one kind or another, and that the vice president believes very strongly that we ought to be talking about this as part of overall policies, not as a separate set of issues. But when you talk about climate change, you talk about education, you talk about health care, this has to be very much part of the seamless garment of that conversation. I come from a family, as Joe does, as Tom Harkin. It gets personal in a way. I'm one of 6 children. My older sister Carolyn was born blind in the country. Back in the days in the 1930s when she was born, there were very little things at all. You could be sent off to a sheltered workshop very quickly if you were blind. And that's where an awful lot of people ended up. And while it was a job, it was really disgraceful in many ways what they were expecting people to do. But my mother, primarily, Mary Grace Murphy, she fought for my sister and insisted that she have the opportunities to prove her abilities. And as a result, my sister became, she helped with 8 other women reviving the American Montessori system of teaching in the United States. She taught or ran Montessori schools for 20 years, and then she took the Montessori techniques to the inner city early education programs in Hartford, Connecticut. Got a master's degree and retired. She's now teaching English as a foreign language in her assisted living program, has a weaving class she runs, and she had a full life because my mother cared, but the country didn't care. And that's what we've got to change, that the country cares very, very much. And that's why I'm here. And that's why for those years I was in Congress, every time I could see an opportunity, along obviously with Tom, our great champion, with the ADA, to find an opportunity where people who had a disability would be treated for all the potential they had to give back not only to themselves, but to give back to our country. So I'm delighted to be here today, delighted to represent the Vice President, who has that same kind of a record and grew up with it as well. When he watched the healthcare system take care of his two sons, when he lost his daughter and his wife, took care of his son who was dying with a brain aneurysm. He had his own medical difficulties and appreciates on a personal level what it means to have a healthcare system that is going to be accessible and affordable for people. He says it over and over again. If I didn't have the kind of insurance that I had, I would have been in deep trouble with my family. When I lost my wife, I lost my daughter, I lost my son, I had the insurance to cover it. If it had not been for that, I would have been in deep trouble. So he gets it, he understands it, not just intellectually. I like people who understand the issues. I want people who feel the issues, who understand it from an emotional standpoint, not just an intellectual one. And I can tell you, having spent 45 years with Joe Biden, going back to the 1975 Rehabilitation Act, the earliest legislation on IDEA in education, and obviously the Americans with Disabilities Act, and of course the Affordable Health Care Act. This is felt deeply by this person, Joe Biden. So I'm delighted to be here and delighted to respond to any questions you may have. Thank you all.
Thank you. Thank you very much. I just want to make note of the fact that we are Facebook live streaming on the AIO conference Facebook page. You need to go to the event section, and so that's just a general announcement, and under the event of the presidential candidate forum. So that's where we're live streaming from today. So you mentioned work there. People with disabilities who are working less on average than workers without disabilities with similar education levels. The median earnings for workers with disabilities is less than 2/3 the median wages for workers without disabilities. This comes from Disability Statistics and Demographics Rehabilitation Research and Training Center in 2011. Furthermore, Section 14C of the Fair Labor Standards Act authorizes employers to pay sub-minimum wages to workers who have disabilities, and many are still stuck working in segregated sheltered workshops. How do you plan to build an infrastructure to address the underemployment and wage gap experienced by people with disabilities? That would be for Vice President Biden.
Well, look, again, I think you're going to hear wonderful remarks, and they're very important, by the way. Again, I'll emphasize over and over again how important what you're doing today is, to have conversations with people about what they understand, what they're for. It's also very legitimate, and I'm sure you will, saying, well, tell us what you've done in your various capacities and positions you've been in before to be active. We watched President Obama and Vice President Biden during the 8 years of their presidency. And I was only there in the Congress for the first 2 years. I retired from the Senate in 2011 after the Affordable Care Act, and I wrote the Barney Frank and I wrote the financial reform bill, among other things. And what we watched the Obama administration, with Joe Biden as a partner in it, insist, for instance, that in the federal government, the largest employer in the country is the U.S. government. And they fought, in fact, the wages and benefits to people who are disabled had been untouched basically for 3 decades. And under the Obama administration, they did more for the disabled community and the very issue you've raised, Catherine, than any administration had done for the previous 30 or 40 years. And so that's the evidence I offer. Now, what does Joe want to do? Obviously, sustain and get back to that. I hope I don't need to explain to people in this room what's at stake in a year from this week coming up, a year. And I've been there to watch it. I wasn't in Congress for it, obviously, but I've been watching it. And again, with just the personal things, watching a president of the United States in front of a large crowd make fun of a person with a disability. I can't imagine in our 243-year history any leader of our nation ever doing anything as President Trump did. And so my hope is that when we talk through these issues, that we have candidates here today, all of them, who will see reversing a lot of these issues we're talking about. But again, the Biden-Obama administration, or the Obama-Biden administration, demonstrated in real terms to me how committed that Joe Biden is to seeing to it that people get fair wages, not based on their disability, but on their opportunities and their intelligence, all their talents they bring to those jobs in the country. So I'm completely convinced that we'll have an advocate and a champion here for the disabled with Joe Biden as the President of the United States. I've watched them. I saw what they did. I guarantee you he'll be there for you as President of our country. Yep.
Medicaid eligibility and programmatic requirements now create barriers for individuals with disabilities
Right.
entering or returning to the workforce because they cannot access needed supports such as personal care attendants,
Right.
power wheelchairs, complex rehab technology, other rehabilitation devices and services, home and community-based services, medical supplies, and therapies. Do you support initiatives that would allow workers with disabilities to continue to work past age 65, maintain eligibility from state to state, and carry their Medicaid benefits into private employment settings?
Absolutely, and let me say again, obviously I've been back in the state in a long time, but I got to tell you how disappointing it was to see what this state did when it came to Medicaid here. It's an outrage in Iowa, and this state, which has done a lot of good things, to basically walk away entirely from that, and having a president, because Medicaid is a partnership between the states and the national government here. And so, unlike some other programs, on this one, the President of the United States can make a huge difference when it comes to this battle. And I don't need to tell anyone in this room or the professionals we hear how devastating it was for this state to lose. That kind of privatizing Medicaid was an outrage, and we're paying an awfully price for it today in Iowa. I get that and I understand it, and Joe Biden will fight to see that doesn't happen. But all the things, Catherine, you mentioned about the portability and those other matters are absolutely essential if we're going to be there. And Joe, as you know, has taken the position of being for expanding on the Affordable Care Act, adding that public option, obviously, and then expanding those opportunities as well. And let me just say in defense of him on this particular point, I couldn't agree with him more. Let me tell you how hard a battle it was. Tom Harkin and I sat together on the Health, Education, Labor, and Pensions Committee. I held the longest markup of a bill. That committee was founded in 1868. Tom Harkin and I conducted the longest markup in the history of that committee since 1868 on the Affordable Care Act to get the bill passed. When people tell me you're going to get rid of it today and start all over, believe me, they don't have the experience then of how hard it was. Thank God we had Nancy Pelosi as Speaker at the time. We had President Obama in the White House. We had Democrats in control of the Senate. And even then it was a fight beyond belief. So when people tell me they're going to scrap the Affordable Care Act, I don't think they know what it's like to fight and get these bills done. So Joe's idea of building on that makes a lot of sense. Let me tell you a quick anecdote. Coming out in the car, I was thinking of this. Ted Kennedy and I were great friends, and we never had a better advocate along with Tom Harkin on health care issues. I asked Ted Kennedy one day, I said, did you ever get involved in an issue that you really regret looking back on your career? He said, I can answer that question in exactly 1 second. He said, in 1968, 50 years ago, Richard Nixon offered Ted Kennedy to establish a universal health care system. Now, the benefits were bad, but the concept of universality was offered, and he walked away from President Nixon's offer because he didn't like President Nixon, disagreed with him on many other things. He said, I made the dumbest mistake. I should have picked up that universality idea, and then the next year after, we'd start expanding benefits. Well, today we need to remind ourselves of moments like that. That's what experience brings, and wisdom when you've been around. So the ACA, Joe Biden is dead right on this thing. You don't scrap that. You got to build on it. You got 129,000 people in this state who today are covered because of the Affordable Care Act. You got 1.3 million people today who are dealing with pre-existing conditions that were protected under the Affordable Care Act. And you've got private carriers, in many cases, who do a good job, and people like them. Why would you scrap all of that for a program that would be very difficult, under the best of circumstances, to get done, with no guarantees? And think of like mental health issues are never included in Medicare, but they are included today under the Affordable Care Act. And I don't want to scrap mental health care. It's an important issue that we need to fight and continue to have as part of our health care system. Sorry about the length of that answer, but it's an important question. Okay. Yeah.
And you'll have a little bit more opportunity to answer those questions when Dr. Cindy Hanawalt from the Lynn County Medical Society comes up. And she asks questions specifically around healthcare and healthcare delivery systems. So thank you for that. So you mentioned IDEA, and it was passed in 1975. Right. And when it was passed, Congress pledged to finance 40% of the differential cost of serving students with disabilities. The closest the federal government has come to meeting that pledge is 19% in 2010. Higher levels of funding will ensure more students with disabilities receive the supports they need in K through 12 and are able to complete high school and have the opportunity to go on to post-secondary education and post-secondary employment.
Right.
How does Vice President Biden propose funding the IDEA at higher levels, and children with disabilities, especially those who are also people of color, have oftentimes unequal access to educational resources despite the law guaranteeing such access? What would his administration do differently? And this kind of goes to an overarching question, which is enforcement. It is one thing to pass legislation. It is another thing to ensure that it is fully funded and enforced, and I think that's what we're looking for.
Well, Catherine, you've answered your own question, in a sense, and because you're absolutely right. And when we reauthorized IDEA in 1990, along the same year we did the Americans with Disability Act, the 40% figure was there. So the law says 40%. You surprised me. I thought the high watermark was 14%. You told me it was 19%. I didn't realize we had 5 more points somewhere along the line. But I can almost guarantee, and this administration is taking a backward step if doing anything at all. And I'm confident. Again, Joe has talked about this. I'm not sort of putting words in his mouth that he doesn't share. Is committed as President of the United States to see that we have full funding of that 40% enforcement. And we need a president that will have a budget, that will insist upon it and demand it and then fight for it. And I've watched Joe Biden fight over the years for things he believes in. And again, people talk about it as if it's a matter easy to get done. Some of the great achievements in our society took remarkable leaders at difficult times. It looks back now as easy. The fight over Medicare was a huge fight, a massive fight to get done. It wasn't all comprehensive when they did it. They grew it over the years and made it better. Medicaid, Title I education, you get down a long list. We had a president named Lyndon Baines Johnson who used the power of his office here and persuadability to get people to go along and support the efforts that he had high on his agenda. And again, under the IDEA, I sit here completely confident, knowing Joe Biden, knowing over the years, when it was not as easy to be for some of these issues 40 years ago. And he was there for us in the early days fighting for it. And today I'm delighted to see more and more people care about it. Unfortunately, we have an occupant in the White House who not only doesn't care about it, but ridicules it. And so we clearly need a change, not just by party, not just affecting a Democrat over a Republican. This is a far deeper problem than partisan politics. This is an outrage, what this man is doing to our country and what he's doing to a community such as the disability community. So again, you know, I'm not a newcomer. I'm not a newcomer to Joe Biden. We literally have known each other since 1974, about the same time I met Tom Harkin. And we sat on committees together. We sat on the Foreign Relations Committee together. So I've watched him day in and day out get the job done. When I was trying to pass the financial reform bill as vice president, he made a difference for me on all the issues we cared about. I wrote the Family and Medical Leave Act, and 7 years fought for that, and got 2 vetoes until finally President Clinton signed it into law. Joe Biden was there to help me get that done. Down the list. So these are not sort of making these things up or pouring over a record. I was there, I sat with him, I know him. And I can tell you, guaranteeing that he will be a fighter on behalf of this community as he will be for other people as well. He understands it and he feels it again very, very deeply. That's the kind of person I want sitting in the Oval Office when it comes to these issues. Feel very strongly about it. Yeah. I was a former senator, so I keep talking too long. I apologize. She's got that sign up all the time on me down here. I apologize. I'll tell you.
No. All right. I have a question here from Vanya Kasov. She is deaf, and she is a wonderful advocate for the deaf community. And I want to read you this question. Over 80% of deaf children do not know sign language, and they are not doing well in K through 12 due to poor language opportunities. If Vice President Biden becomes president, what can he do to change this national crisis?
Well, it's a good point. I live about 4 blocks from Gallaudet College in Washington, D.C., and I grew up, my best boyhood friend was Denny Gallaudet. It was his great-grandfather, a doctor in Hartford, Connecticut, that started the Gallaudet, the school, that dealt with some of these issues, obviously, and the deaf and blind as well. And again, I think it's again tragic that we have such a small percentage of people who are not getting the kind of training. And again, that goes right to the employment issues and everything else. So we need to have, again, support in the country. We need an educational system. We didn't touch enough on the education piece that that Vice President Biden is for. And obviously, in fact, we talked about it a little bit earlier, and that issue of getting more nurses, more psychologists, more counselors in our schools, particularly in the less advantaged schools where you have more minority children that have as many problems, more problems in some cases, here to see to it that that IDEA bill is catching up with all the promises we made in '75 and in 1990. And again, this is another example of it. Obviously, you've got a significant number, I don't know the exact number, of children growing up who are deaf here and need to get those tools. We need to get the ability to have also the availability of videos and other things that are accessible to those with the kind of opportunities and having the captioning and so forth that people can be in touch of. My sister, for instance, I mentioned being blind growing up. Textbooks, for instance, and it's a different subject matter, but not entirely different. They don't publish the Braille books. Only 10% of the blind read Braille in the country. And because you don't have the access. And the publishing houses would publish the textbooks, but it would be months before the textbook in Braille would come out. So a child going through school in a biology class or a math class, if they were blind, had to sort of have someone read to them every night rather than having access to those educational materials. So again, different constituencies are also feeling this. It hurts everyone when we can't take advantage of the talents and the abilities of people who have a disability, such as hearing or sight, to be able to contribute to themselves, but to contribute to all of us. We need to talk about the disability community, not just in what you need, but it's what people like me need and my children need. They're not don't have disabilities, but we have benefited because when we have a community that is active and engaged in improving the quality of life for all people, everyone benefits. Not just the disability community, but the entire country benefits. And I want a president that thinks that way when they're in the White House. Think about the totality of it.
Thank you. We are often found in this community of saying that when you make it accessible for one, you make it accessible for all. Right. So with that, I would like to introduce Dr. Cindy Hanawalt. She is the most recent past president of the Lynn County Medical Society, and she's going to address questions with you with regards to health care.
Terrific. Doctor, how are you?
Good. How are you?
Nice to be back in Lynn County here anyway.
Thank you. Well, we appreciate you joining us today.
Oh, happy to do so.
And I know there's always a lot to talk about and not a lot of time to do it. I'm going to go ahead and start with our discussion of the ACA.
Yeah.
And we've heard a lot from presidential candidates about Medicare for all. And as physicians, we have wonders like, well, what exactly does that mean? But what has struck me is Vice President Biden's stance on that we have an ACA that we need to build upon and not necessarily scrap it all. I would like to learn a little more about some of the intentions of building on the ACA. Can you comment on some of the things that Vice President Biden is looking at?
Well, the big item, obviously, and I fought like heck when we were doing the ACA to have the public option in the bill. And I come from Connecticut. I come from the insurance state. You can imagine how warmly I was received by the insurance industry when I was an advocate of the public option as part of that bill. And unfortunately, we couldn't get the votes for it. We lost Democratic votes on including the public option. Which would have made a big difference in my view. While we've made a difference in the lives of 20 million Americans, and we made, if you add more, 80 million more dealing with pre-existing conditions here, then already it's making a difference. And if we can get other states to start to do the things on Medicaid and so forth we talked about, that I think we can build. Much as the Ted Kennedy story, I think has value for an audience. When asked what the greatest mistake was, turning down Richard Nixon on a universal health care system 50 years ago. What a difference we'd be in today had that been the case. So the public option is a major feature of what Joe is talking about as having part of that as well. And then doing the other things we've already touched on a bit as well, and dealing with the communities that make us whole as a country again. And that it's not inexpensive to do it, but it believes because we're seeing already the change. I watch with a fascinating way. I not only like to watch what people of my own political persuasion do, but what the opposition is doing. And while the first year or so, they were running around with 80 different votes they had in the House of Representatives to abandon the Affordable Care Act. You haven't seen those votes in the last few years when the Republicans were controlling the House of Representatives and the Senate. They walked away from that, in a sense. The day that John McCain put his thumb down, for those of you who remember that day when the vote was there to do that, we had John McCain, a Republican, one that stood up for it. But they all of a sudden stopped offering the amendments or the legislation to scrap the ACA altogether. So they're beginning to realize this is working. That's why they don't want to go back to their constituency and tell them they walked away from a program that's providing some real benefits for people for the first time. So I think we're in a stronger position now to build on the ACA than we might have been 8 years ago when things started out. So obviously the public option is a major piece of it, obviously talking about things like the education piece we mentioned and so forth. Also, and I know you care about this a lot, Doctor, and that is rural health care. And this is, again, the Vice President has talked about this. I talked about it in this state and elsewhere. In my little state of Connecticut, which is a small state, I have 32 hospitals in my state. I now have 3 hospitals, basically, because of the consolidation. Worries me because you lose that touch. The people, those doctors, those caregivers in that rural environment, they know everybody. When you walk in, they know the family history. They can do this. All of a sudden, you get these consolidations, and it's all about the bottom line with many of them, and they try to be efficient, as they say, but the efficiencies mean denying or delaying the kind of treatment people deserve on a variety of issues. So the rural care needs grants, direct money. We need to reorganize how we do the telehealth programs here, emergency rooms 24/7. He's advocating, so at least people can have that kind of care and support that in our rural settings. And then we need to get the one thing on consolidation, not that I like consolidation, but again, people understand what each can do. They don't need to do everything. In a state like Iowa, which is not huge, obviously there are distances, but within regions, you have a hospital that does certain things that other hospitals don't do. They do other things. That way there's a shared community of hospitals and caregivers that can fill in those gaps that are needed instead of everyone trying to do everything. And that way we become more efficient in terms of healthcare delivery and see to it that we maintain. You cannot leave. If you're going to grow a community, if you want economic development to come to smaller towns in Iowa, you cannot lose health care. You lose health care before, I don't care how many jobs you think you're going to attract, you're never going to get businesses to locate if they can't have health care for their employees or their families. And aside from that, of course, usually the largest employer in that rural area is that hospital or is that health care provider. That's an economic driver. But you try and grow a small town without having rural health care, it won't happen, in my view. So everyone's talking about plans for economic growth. You better add the word hospital and health care in that equation, or you're not going to get it, in my view. Not at all. Yeah. Am I bellowing? I am bellowing.
No, that's okay.
I'll calm down. I'll calm down a little bit. It's okay.
All right. And so you touched a little bit about our rural communities. Yeah. I would like to talk about Medicare now. That compared to the rest of the country, Iowa ranks near the top among states in proportion of Medicare beneficiaries. Right. Yet Medicare reimbursement to Iowa physicians rank among the lowest in the country. Yep. As physicians face increasing practice expenses, professional liability costs, and new physicians face increased debt from medical training, how do you propose to offset the inequalities in Iowa's Medicare fee schedules to avoid limiting patients' access to care and offset cuts that could jeopardize the delivery of standard of care?
A great question. And I'll give you the shortest answer to this one. You are so lucky in the 1st Congressional District to have a young woman by the name of Abby Finkenauer. Abby Finkenauer has a bill, that addresses exactly, Doctor, what you've just talked about. And Joe Biden is an absolute total supporter of Abby Finkenauer's legislation. And that does exactly what you've asked. That is, get the reimbursement rates up in rural areas so doctors will have a rationale to keep providing that kind of health care, along with the other items that are in her bill. But we already have, and I'm sure others may have similar ideas, but Joe Biden has made it categorically a top item for himself, because you cannot succeed if you're in a rural area if you don't do that. And again, here, the aging, an older population. I have an older population in Connecticut as well. And so these issues are not just Iowa issues here. We're getting older. I grew up as one of 6 children, I told you. We were an average-sized Catholic family in Connecticut growing up. Today, you're almost an oddity if you have 5 siblings growing up. So families are smaller today. The population aging, healthcare is allowing us in some cases to live a lot longer. I've got a metal knee, I've got stents, I've got all sorts of things that are keeping me with a family that didn't have a great longevity history along the way, so I'm hanging around longer. By the way, I have a brother who has Alzheimer's and has 24/7 care. I have another brother with cancer who's struggling. I have another brother has diabetes, requires care, and I'm the primary caregiver of my siblings, organizing it. And so when I meet caregivers, like this young woman over here with a gentleman whose book I love, As I Am, and I'll read that on the way home, and I thank you for that along the way, I can relate to the problems families face. My parents died very young, and so I never had to go through the sandwich to conversation about your parents and your children. It never occurred to me that with my older brothers and sisters, I'd be confronted with the issues at this age. And I have young children. I have a 14-year-old and an 18-year-old, as I said earlier, but my brothers and sisters are in their 80s. So I'm caring for my older siblings as well as my children coming up. And that's good news in a way. I'm delighted to do it. I think it's a blessing, in my view, to be able to care for my brothers and sisters. But I can afford to do it. What makes me crazy is thinking about people who can't. And you need someone. My brother, because I got him in a decent place, it's difficult. He doesn't remember me. He's got really advanced in Alzheimer's. He's healthy. He could be with us. As they tell you, Alzheimer's patients, if you've seen one, that's all you've seen is one. Every case manifests itself differently. My brother could be with us the next 5 or 10 years, but he can't survive without a caregiver. And we didn't get into that subject matter, but that's presumably you relate to that issue as well, Doctor. Anyway, sorry about that. It's good. It's personal.
Thank you so much for your insight.
No, hope that was helpful. Yeah.
Thank you very much.
And tell the Congresswoman how much we appreciate what she's doing in her leadership on that issue, by the way.
So I would like to thank you very much. You were our very first.
I'm the guinea pig. Huh?
You're the guinea pig. So we're going to work out all of the, all of the whatever is
Yeah.
going to come, right? So thank you very much for being with us today. I know that you flew out specifically to do this event.
right.
So we really appreciate that quite a bit. We're going to go on probably about a 10-minute break now. You'll have an opportunity to speak with Senator Dodd if you would.